to join in. We're going to give everybody a few extra minutes here to get logged in. So in the meantime, I'm going to do some quick introductions here to allow folks a few extra moments to log in and join us. So my name is Alan Obringer. I'm the president and owner of Guardian Pharmacy of Orlando. I'm a pharmacist, consultant pharmacist, and geriatric pharmacist here in Florida, Central Florida to be exact. I am joined today by Dr. Michael Samarkos, who is the Regional Director of Clinical and Consultant Services for Guardian Pharmacy in both Orlando and Tampa. Today, we're going to be talking about the COVID vaccines. Hopefully, we'll give you some insight into all of the latest and greatest news. We'll let you know how they work. We'll try to give you as much information as we can. And again, today is geared towards residents, towards caregivers. We are doing this again next week at this same time next Wednesday for healthcare workers. But really the overall and overarching goal of all this is to encourage you to get vaccinated, provide you with the information that you need to make an educated decision on your own. There's a lot of false information or not accurate information that's out there. So we're going to hopefully give you guys, like I said, the latest and greatest of the facts as we know them as of today. We're going to talk about some of the things that have happened within the last week or so as well. So it is very much an up-to-date presentation that we're going to do today. So with that, I think we will go ahead and get started. And as folks join in, we will have plenty of time at the end for questions. So if you do have a question, use the Q&A function of the Zoom meeting if you can. If not, we'll try to leave a bunch of time at the end to make sure that we get to everyone's questions. This program is designed to be short so that we have tons of time to answer anything specific to any individuals or anything for the good of the group. So if you have a question, now's a good opportunity. I know that I speak for Michael when I say this. For the last probably, what's it been now, like three and a half months, we have been on full vaccine alert, learning everything we possibly can about the vaccines, about how the phased implementation of vaccination is working, who can get vaccinated, when, where, why, how, all that kind of stuff. So we will do the best we can to answer any of those specific questions, and hopefully we'll address some of them as we go through our presentation today. So again, good morning, everybody, and thank you for taking some time to spend with us today.
Yep. Good morning, everyone.
So as I mentioned, our real goal here is to just we'll do a really quick overview of COVID-19. I think at this point, better than a year later of the first cases in the United States, I think we're all pretty familiar with the disease itself. We're going to spend a lot more time talking about the different vaccines and how they work. And again, we know that this is, our audience today is caregivers. So we'll get a little bit into the science behind it, but hopefully we'll do it in a way that everybody can understand and keep up and stay with us, because we really want to make sure that you understand why and how the vaccine works and what that means for someone who gets vaccinated. Because some of the common questions are, can I get COVID from the vaccination? And we'll obviously address some of those common questions today. We also want to take some time, like I mentioned, giving you the latest and greatest. So we're going to talk a little bit about the variants that have been seen. It's still COVID-19, but it's a little different version. One is in the United Kingdom, there's one in Brazil, and then there's one in South Africa as well. So we'll talk about those variants, and we'll talk about what's the current vaccines that are out there, how well they work against those variants, and give you some information there as well. And then we're going to spend a good portion of the end just going through a lot of the common questions that we've seen and we've been asked. And like I said, leaving a lot of time for any additional questions that you guys may have at the end. So again, use that Q&A function. The way that Mike and I like to do these presentations, if there's a question that comes up in the middle and it's something that we're talking about, one of us will be monitoring that at all times, and we'll share that question and try to get it answered while we're talking about the topic. If not, hold your questions to the end, and we can certainly go from there. And I see our first person has already asked their first question. So Well, let's just address it now. So I had the Pfizer vaccine, the first vaccination last Wednesday, with vaccine supplies being limited. How close to that 3-week second vaccine date do I have to have that second shot? So the latest and greatest is anytime within 42 days. So they've actually doubled the length of time. So the Pfizer vaccine, you should have the second shot in 21 days. It's okay as far out as 42 days at this point in time. They are releasing, I actually just saw this morning, they're releasing a bunch more vaccines. There are a number of sites here in Florida as well that are starting to make sure that they're prepared for those second doses. If you just got it on last Wednesday, you still got another couple weeks. You may actually be able to get it close to that 21-day mark. A day or two before is fine as well. They're really trying to go with 21 days or later, but up to 42 is the mark that they I think released last week. I think, Mike, was when they did the official update.
Yeah, they did, and actually there's a second question, which is basically the same question regarding the Moderna vaccine, and it's both vaccines that they've said, up to 42 days for the booster dose is fine. They're actually doing some studies now where they're looking at if you originally got the Pfizer vaccine, can your booster be a different vaccine, and how effective will that be? So hopefully those results will be out soon and make some of the logistics of getting, especially the second vaccine, a little more reasonable for everyone.
All right, so let's get rolling here. So just a brief overview of COVID. Obviously, I think we all know at this point it's a respiratory illness. It spreads mainly through air droplets. So think coughing, think sneezing, think spending an amount of time, and it's about 15 minutes is kind of the time limit that they've gone with, where you're talking to an infected person at close distance. So we've all done the social distancing thing where we're 6 feet away from folks. We're all wearing masks. My mask is never more than an arm's length away. So we're all wearing masks, with everything that we do. And that really does keep you safe. And we'll get into some of the ways and hows that stuff actually works for us. So obviously there are now vaccines out there. There are 2 that are approved and available. That's the Moderna vaccine and the Pfizer vaccine. There is another one that should be available here, any day now, and that's the Johnson & Johnson vaccine. We'll talk about those specifically in a couple of minutes. And just remember, when you're thinking COVID, there still are some common symptoms, and there's a lot of new symptoms, and there's articles every day about, hey, maybe this is a lesser known symptom, but just the main things. Obviously, cough, fever is a big one, headache. That loss of taste or smell is something that's unique to COVID as well. And of course, because you're coughing and such, chest pain, shortness of breath can come along with this. And again, that's what we think of when we think respiratory illness, is just it makes it harder to breathe. So the symptoms are usually present 4 to 5 days after being infected, but it can take 14 days to be present. So I think we've all heard on the news, or we've seen, that time frame where you need to isolate away from folks is 14 days. And that's the reason that you need to do that, is because it can take up to 14 days before you start seeing symptoms. So isolation for 14 days for folks that have come in contact, and then the ability to go back out and see folks from there.
So just real quick, Alan, there's another question here on side effects of the second vaccine. And are they different between the 2 vaccines? So the side effects and such is something that we'll touch on. I actually feel pretty good, better about our presentation, being that we've tried to answer a lot of these questions already. And from everything that we've heard and what I've heard from the majority of patients in our long-term care facilities, as well as the caregivers in those facilities, they had more of a reaction to the second shot than the first shot. It was a generality, not the rule. I know that's not a solid answer to your question, but for the most part, it appears that your immune response, the side effects that you get, which is basically not feeling well, is more distinct after the second shot than the first shot.
Yeah, and,
So-
and I would add to that, Mike, that it doesn't matter which one you get. So we encourage
Right.
you, whatever shot is available to you, that's the one that you should get. So, but again, we'll discuss that in a few minutes. Sorry, Mike, go ahead.
No, no worries, no worries. So a little bit about how vaccines work. We all know vaccines have been around, for a while. They've done wonders and eliminated some pretty bad diseases like polio and smallpox, and pretty much eliminated things like mumps. So, they've been part of healthcare practice for quite some time. They've been effective and, obviously helped us all survive just a little bit better. What do? They basically expose your body to a little bit of an antigen or something that causes your body to react with an immune response. So as we'll talk about a little later, most of that not so great feeling that you get after your vaccination is your immune response to the vaccine. So the vaccine is designed to initiate a response from your system so that you create antibodies should you actually see, in this case, a virus or whatever it happens to be that you're getting vaccinated against. If that tries to infect you, your body has antibodies, which are a natural part of your immune system to fight the particular antigen that you've exposed it to. So Alan's touched on this already. There's a couple different vaccine options. The Pfizer vaccine and the Moderna vaccine are the ones that are available. They're similar but different. There's two that are in the pipeline. Johnson & Johnson is waiting any day to get its FDA emergency use authorization. The AstraZeneca vaccine has been approved in Europe, not yet approved here in the US, but eventually here all of these will be available, and maybe some others as time goes on, to really add to the toolkit of preventing this disease. So some of the big questions we've gotten, especially as the vaccines were rolling out, is how do they work? It's something different. What is this mRNA vaccine? And the reservations that come with something new. And what I try to tell people is, just because something's new doesn't mean that it's bad, or it doesn't mean that it's ineffective. It's just new. So we all have our reservations, but education is the key to making sure we understand, how these things work. So the Pfizer and Moderna vaccines are messenger RNA vaccines. So these vaccines have the messenger RNA, which is a little piece of information that tells your own immune system how to create the spike protein on the virus. Why is that important? Because that little spike protein is what our antibodies that we're going to create once that little spike protein is created. These antibodies will recognize that protein when it's on the outside of a virus and be able to block it and eliminate it before it attaches to our cells. AstraZeneca and Johnson & Johnson, they're doing it a little bit differently. They're not direct mRNA vaccine. Their vaccines will carry, it'll be an adenovirus, which is actually another virus, right, that will infect your cell. And within that virus is similar messaging from the COVID-19 about the COVID-19 virus, to also have your cell create a spike protein, and you end up forming antibodies to that as well. So it's two different ways to accomplish the same thing. Each of the vaccines that are currently available have some different ingredients, and they have some similar ingredients. There's been discussions, especially on the news, of allergic reactions, and I've been in facilities where, folks have had an allergy to the vaccine. I have yet to see a true anaphylaxis, but there are reports that they exist, and it's suspect that polyethylene glycol, or PEG 2000, which is in many different medications, not just in these vaccines, is probably the ingredient that's causing most of these anaphylactic reactions. Now, of course, it could be some of the other ingredients, but a lot of the other ingredients are a little more common, and you see them whether they're in medications or other things. We can tell the difference between these two vaccines is one has a little more mRNA, one has a little less mRNA. They both use lipids and cholesterol, and that is to get the mRNA into your cell so that it can do its job and activate that creation of the spike protein, which activates your body creating antibodies against that infection. So we've already had some questions about side effects. And as we can see here, both vaccines that are currently available have pretty much a similar side effect profile. And if you go through the side effect profile, it sounds exactly like you're getting sick. And that's because your body's immune response when you do get sick is doing the same thing as the immune response that is caused by getting the vaccine. So injection site pain, that's the one thing that obviously is different than actually getting sick, but tiredness or headaches, whether it's myalgia, muscle pain, or getting chills or joint pains, fever, all these things come along, with every time we get sick or we get a cold or some other viral infection. So it's not unexpected that they happen post-vaccination. So this is a really great chart. It's a pretty interesting chart to me because it takes two vaccines that are really common, and which is Shingrix and flu vaccine, and it compares them to the Pfizer and Moderna vaccine as far as the side effect profiles. And oddly enough, especially the Shingrix vaccine has a few statistics that, as far as side effect occurrence, that is a lot greater than the COVID-19 vaccines, and even the flu vaccines have a lot of similar side effect profiles. But why is that? Each of these vaccines is, again, designed to cause our bodies to have that reaction of creating antibodies and doing our job internally to fight off these diseases. And it's shown right here in the chart, really, that it's really a very similar profile. Sure, there's some differences, but for the most part, our immune system response is similar across the board. So here we have some comparisons of the vaccines that are available. And we talked about how Johnson & Johnson is one of those any day in the pipeline vaccines, and AstraZeneca has been okayed in Europe and not yet here. If we look at the effectiveness after the first dose, the Pfizer vaccine is a little over 50% effective. The Moderna vaccine is around 80% effective. And Johnson & Johnson is a one-dose vaccine currently, and that's around 72% effective in the United States, 66% overall. Those vary. It's somewhere in the neighborhood of 70% effective overall. And as we can see with the AstraZeneca vaccine, it's also around 70% effective after the second dose. So across the board, the effectiveness is similar. The costs are a little different. The dosages are a little different. Some require 2 doses. Johnson & Johnson right now is at 1 dose. Those days in between shots, as we touched on earlier, has already changed and will probably change again. But you could pretty much have 42 days across the board for days between shots. So much like everything with COVID, the more we learn, and the more dynamic this process becomes, the more information we can get out to everyone, and we can all make the best decisions as far as what vaccine is right for us. What do we need to do in between doses? What if we can't get a second dose, and what if it's not the same drug, and all these questions that are getting answered on a daily basis.
Mike, before we move on to variants, I think it's important to one note that we've included the cost here on this particular slide, but here in the United States, the government is covering the cost fully. So there is no cost to anyone as far as the doses of the vaccine are concerned. And there's a question from one of our attendees, Mike, for you, and that's, are you getting the same vaccine strength twice? What's the difference between the first and second shot?
So the answer to that is yes, you are getting the same vaccine dose twice. There isn't a difference between the first and second shot. The second shot is a booster. We have booster shots with other immunizations already. It's similar to that. So it's the design of the second shot is really to make sure that you got the maximum immune response that you can out of the vaccine, and that the length of the response, or the amount of time that you have effective antibodies in your system, is as long as it can be.
And another good question that just came in: when the side effects, you do experience those side effects, are you contagious in any way?
So the answer to that is no. There's a slide on this a little bit later. When you get this vaccine, you are not getting COVID-19, the whole virus. So you have to have the whole virus in order to actually have the disease. You cannot just have part of the virus and have the disease. So because these vaccines are designed to only create the spike protein of the virus, which is just a little part of something that's very small to begin with, no, you're not contagious per se as far as having COVID-19 and being able to spread it to someone else.
Yeah, and I would mention that, what we've seen is really nobody has, the side effects of those things have all gone away in 24 hours. So we've had folks that have gotten the vaccine, particularly the second shot. And as Mike mentioned, it's the same as the first shot, and had experienced some symptoms, and some side effects, but they all went away in 24 hours. So let me just check this one. All right, so with that, Mike, I'll pass it back and we can talk a little bit about the variants.
So thank you, Alan. So Alan had touched on the variants earlier, and right now there's three major ones. There's all kinds of minor ones. Every time you flip on the news, there's another variant in the United States. There's another European variant. There's an Asian variant. There's an African variant. So it's going to happen. Viruses mutate. The correlation that I have used to help people that have this kind of question is, the flu virus. We all know that the flu virus changes all the time. It's basically similar, but it's a little different, every year, and there's different ones floating around all the time. So of the three major variants we're going to discuss today, there's B.1.1.7, which is the UK variant. There's B.1.351, which is the South African variant. And there's P.1, which is the Brazilian variant. And the UK and South African variants are shown to be more infective. They spread at a higher rate. I haven't seen any information yet that shows that anything is any deadlier. Generally, from what I have learned, as these viruses progress, they may become more infective, but they become less severe over time. If you think about a disease that becomes more deadly and more infective, it's going to eliminate itself. So part of these variations is just a way, that normal viruses that we've all seen before also mutate to try and keep themselves in existence, so to speak.
So let's move on to some of the common questions that we've gotten over the course of the last several months. And again, this isn't going to be all the questions that you have, so keep firing them in. You guys have been great, and we've gotten some good questions so far. So we're going to go through quick, and we have answers to all of these, but we're going to talk about who should or shouldn't get the vaccine. Should we wait? Who should wait? Why should we wait? What's herd immunity? I know that we hear a lot about herd immunity. If I had COVID already, do I need to get the vaccine? And then we're going to end with, as Mike just mentioned, the new variants that are out there. well, these new vaccines, are they any good against those new variants? And we'll give you some details there as well. So the first question is, who should get the COVID vaccine? Well, currently the recommendation is for anyone who's over the age of 16, right? It includes anyone who previously had COVID. So if you're someone, and a gentleman that Mike and I work with actually had COVID, gosh, almost exactly a year ago. But he, like everyone that had COVID, should be getting the vaccine as well. Certainly high risk individuals. People who are pregnant or lactating mothers should get the vaccine. People with poor immune systems should get the vaccine. People with autoimmune disease or rheumatologic disease, so rheumatoid arthritis, things like that, you should get the vaccine as well. We do suggest for those high risk individuals that you absolutely should talk to your doctor first before going to get the vaccine, just to update them on your condition. But don't be surprised when the doctor says, yeah, absolutely, you should get it. You are included in that high risk category, but you should be one who gets it. So if you have any of those high risk things, make sure that you're talking to your doctor. If you have any questions, or if you have anything else going on with you that we don't know about, make sure you talk to your doctor first. But like I said, the overarching recommendation is that there are very, very, very few people that shouldn't get it. So again, be prepared for the doctor to say, absolutely, you should get the vaccine. So who should not get it? All right, there's really two patient populations. We talked about it's approved for anyone over the age of 16. So kids under the age of 16 should not get it at this time. And then if you have a serious allergic reaction, all right, and by serious allergic reaction, we're talking about your throat starts to close and you can't breathe. You need to have epinephrine or an EpiPen administered to you. Those types of serious reactions. If you got the first vaccine and, as Mike talked about, experienced some side effects, you just weren't feeling well, you took a dose of Tylenol and you were okay a day later, you should get the second dose. All right. You should anticipate that, hey, I'm probably going to experience those symptoms again. But we're really just talking about those who have anaphylaxis, which again is something that would require an ambulance to be called, and pretty severe reaction to that, that should be absolutely not get the vaccine. Who should wait to take the vaccine? Well, a couple people. So I think you've heard about the monoclonal antibody infusions. So if you get COVID and you are in a nursing home or you are in a hospital and they give you the antibody infusions that have come out, if you've done that within the past 90 days, you should wait until that 90-day window is over and then get vaccinated after that. All right. So you're someone who has had not only COVID, but also required the antibody treatment to lessen your symptoms while you had it. Wait that 90-day period after that, after you've recovered, before you get that dose. If you've gotten another vaccination, now fortunately for us, we're coming out of flu season, so hopefully everybody got their flu shot, in the fall. But if you've had a flu shot or any other vaccination within 2 weeks, you should wait until that 2-week window is up before getting the COVID vaccine. And again, the reason behind that is actually just pretty simple. Your body, if you just got a vaccination, your body is working on building antibodies to fight the flu. So we don't want to give it too much to do by introducing, like Mike said, a little snippet of COVID proteins and having to build a second immune response. So if you wait that 14 days, you will have built your immunity to the flu or whatever other vaccine you got, and then it is safe and you will get a full response to the COVID vaccine at that point. Why should I consider getting the COVID vaccine? Well, this is pretty simple. This is the tunnel that leads out of having to wear masks and not being able to go to restaurants and coming back to some sense of normalcy, after more than a year now. So if we can get enough people vaccinated in a quick enough amount of time, we can get rid of COVID. All right. And that's just the simple fact. We can make sure that COVID is not bothersome or impacts us in any way. If not enough people get it, then COVID will hang around and it will always be a risk. And it's certainly not something that we want to be out there and risking our health as we're dealing with patients or anyone else. You'll hear about herd immunity. We have a slide in a few minutes that shows a graphic of how herd immunity works, but we really need to reach about 75% of the population to reach that herd immunity standpoint. And basically what that means is that there's enough people that are vaccinated and that are immune to the disease that COVID decides that, hey, there's not enough people here for me to infect, and it goes away, right? So again, and if you think about those folks that can't get it, or those folks that are too young to get it, by you getting the vaccine, you are helping to not only protect yourself and your family members and your loved ones, but you're also helping to protect everyone that can't necessarily get the vaccine as well. So what is herd immunity? And you can kind of see the graphic that we have here. And as you get to 90% of people vaccinated and 95% of people vaccinated, you can see why there's no really red dots. Yeah, a person here or a person there might end up with COVID, but we like I said, not only protect ourselves, but protect everyone else around us from being able to get COVID if we can get enough people vaccinated. So this is one that I think we kind of already touched on, and that is, will the vaccine make me sick? So the answer, unfortunately, is yes. And you kind of need to know that going in, right? You need to know that, and Mike showed the statistics, but there's a high likelihood that you're going to have some sort of side effect to the vaccination, all right? It's a trade-off, folks. I don't know how else to put it. I would rather have my arm hurt for an afternoon than get COVID and end up in the hospital, end up on a ventilator, end up, like so many other folks with some serious consequences. So go in expecting that you're going to see some side effects, some symptoms. But again, the most common thing is injection site reaction. So sore arm. I got my injection in my left arm, and my arm is sore. Mike talked about the other things that you can, just not feeling well, that feeling like you're coming down with something. But again, like I mentioned before, for all the folks that we've seen vaccinated, we've not seen anyone that carries those side effects past 24 hours. In most cases, if they're able to take a dose of Tylenol, then a half hour, 45 minutes, an hour after they take the Tylenol, those symptoms are starting to resolve. And like I said, for most folks, they go to bed at night, they wake up the next morning, and those side effects are gone. So the CDC says you can have side effects for a couple of days. Like I said, our personal experience is we've not seen anyone past 24 hours. So it's possible for a couple of days. But again, go in expecting, okay, there's probably a good chance that I'm going to have some reaction to this shot, but it's obviously a lot less severe than actually getting sick with COVID. So that's why we definitely want to encourage it. Mike, I see a couple of questions in the QA. Anything that we should address now, or?
Well, the first question is actually not one that we addressed, but it's a good question. So I donate blood regularly, and after receiving the second vaccination, should I wait a number of weeks or longer before donating? So I did a little research while we were here, and according to OneBlood, if you receive the Pfizer or Moderna vaccine, there is no waiting period to donate blood or platelets after receiving these vaccines, and you can donate anytime. However, if you receive the COVID-19 vaccine from any other manufacturer, you must wait 2 weeks before donating. So I think that's a pretty good answer to that question, and I actually think we'll expand our presentation by that question, because that's a good one that we haven't heard before. And then there's another question. So I heard that even once you are vaccinated, you can still be a carrier. Is that true? And I think we're going to touch on that in just a little bit. I think once you're fully vaccinated, the answer is we're not really sure. I know that after the first vaccination, multiple people, especially in some facilities that we service, ended up COVID positive, but asymptomatic. So they're COVID positive with a verified test. They're asymptomatic, so they never really got sick. But if you're COVID positive, you can spread the disease. I think the jury's still out on after the second dose. There's been reports of folks that after the second dose have ended up COVID positive as well, somewhere in that 7 to 14 day window after the second dose where you're really not fully vaccinated. And again, all of these vaccines are not 100%. So until we get to that herd immunity that Alan talked about, we're going to end up having to continue with precautions, and we'll touch on that in just a little bit.
Yeah, I think that's a good point, Mike. What has been seen, and there were 4 cases in Oregon, and there were 2 separate areas of Oregon, but there were folks that tested positive for COVID after 2 weeks after they had gotten their second dose, which suggests that it's possible that you could be a carrier, and that's why it really looks like, certainly now, if you were to get your 2 shots, you want to keep wearing your mask and make sure that you're protecting yourself and others. But it looks like we're going to continue, like Mike just said, to have to take precautions until we get to that point where we've had enough folks vaccinated where we can start to relax some of that kind of stuff. But in the meantime, the safe answer is the best answer. So, stay protected. It looks like, and again, 4 cases, of the hundreds of thousands of folks that have been vaccinated isn't proof of anything like Mike had really talked about, but it certainly leads us to think that maybe you can be a carrier. So keep wearing masks for now, even if you've had both vaccines. And we'll like I mentioned, we'll touch on it. Like Mike mentions, I should say, we'll touch on it again in a minute. So next question we see a lot is, how do I know if the symptoms I have are from the vaccine side effects or actually from COVID-19? Most of the side effects of the vaccine are really localized to the site where you got it. And COVID doesn't make the injection site hurt, right? So that one's an easy one. So depending on what it is that you have, you really probably can link it pretty easily to the fact that you just got your vaccination. Hey, my arm is red. Well, you just had your vaccination. That's more than likely from the vaccine and not from COVID. So what the vaccine does not cause is cough, stuffy nose, and the vaccine does not cause that loss of taste or smell that we hear about all the time. So if you have those types of symptoms, I would go and get tested to see if you test positive for COVID-19. Really, a lot of the other ones, look to see if that lasts for more than that 24-hour window that we've been talking about, and if it does, that's the time to go get tested after that. But again, like I said, the loss of taste and smell is the normal one that if you're experiencing that, it's more than likely from COVID and almost certainly not from the vaccine. So if I already had COVID, do I still need to get the vaccine? Absolutely yes. All right. The antibodies that you made when you were sick, depending on how long ago you got COVID, we're not sure how long those antibodies last. So and we do know that the antibodies you get from the vaccine are fairly long lasting. So we want to make sure that if you had COVID in July of last year, you should be getting the vaccine at this point in time and building an even stronger immune response. Those folks that I mentioned that had both doses of the vaccine out in Oregon that did get sick, not one of them had. They were all asymptomatic. They were exposed, which is why they got tested. Why they took a COVID test and ended up testing positive. But the one thing that we are certain of is that if you do get vaccinated and you do happen to get COVID again, the severity level of COVID goes way, way down. So again, that's why absolutely, if you had COVID previously, you should still get vaccine. This is an easy one, right? And I think Mike showed you the process in which you become immune to COVID from the vaccine. So can I get COVID from the vaccine? The answer is absolutely not. Absolutely not. There is not a significant portion enough of the vaccine, of COVID in the vaccine, excuse me, that you could actually then test positive from the vaccine. All right. So the answer is absolutely no. You cannot get COVID from the vaccine. Can you experience some side effects? Absolutely. We've talked about that, but you will not and cannot get COVID from the vaccine. So Mike, I know that this next question is one of your favorites, so I'll pass it back over to you.
So Alan likes to point out that that this is my favorite slide, even though it's, well, anyway, he's just picking on me because I'm a germaphobe. So do I still have to wear a mask and social distance after taking the vaccine? So we had this question already, and the answer that we touched on is yes. So what we can see here in this slide is basically mask and no mask, one sneeze, one cough, how far away, you know, singing and talking, two coughs, what grows on these petri dishes when someone is not masked. And then you look at the right side with the distances, you know, and you say even out to 6 feet with no mask, you know, we're all 6 feet apart and social distance or whatever iteration that is taken now. But this really illustrates the importance of, you know, that mask to contain the droplets that we express all the time, whether it's just talking or a regular sneeze or singing. You know, there's been a lot of mass infections that have happened at gatherings, you know, like church, where they're singing and hymns and chorus, well, unknowing at the time, but that was, you know, putting a lot of infectious particles out in the air. So really a great slide. I really, I think it really illustrates the need to make sure we're wearing a mask, not only to protect ourselves, but to protect others from us should we be infected and not know about it. So does the vaccine impact my DNA? So it's a big question, right? There's mRNA in the vaccine. What is this mRNA stuff and how does it work? And is it going to get in and change my DNA? And the answer to that is no. So mRNA is messenger RNA. Your DNA is in the nucleus. Messenger RNA does not ever go into the nucleus. It works in the ribosomes. And that's the part of your cell that creates other things. Every cell has them, and they all collect messenger RNA, which tells them what to do. So the broad answer to the does the vaccine impact my DNA question is no. So this vaccine was made really quickly. You know, somebody must have just had it in their back pocket and we can't trust it. Well, that's not true as well. So novel COVID-19 virus that we have now is brand new, but these types of coronaviruses have been around. We had the original SARS, which was a coronavirus in the early 2000s, MERS, which is Middle Eastern Respiratory Syndrome, which was also a coronavirus after that, Ebola, which I just read an article yesterday that Ebola is back, I think in Guinea, and that's a coronavirus. So scientists at Pfizer and Moderna, as well as other companies, have really been looking at ways to get at these coronaviruses that historically have caused pretty bad diseases. And really, if you look historically at COVID-19 versus some of the other iterations of coronavirus before today, it's not quite as bad as those. So we know the FDA has a process to approve vaccine that are administered in the US, and the studies have actually gone on a little longer than usual. So these Pfizer and Moderna especially have gone to great lengths to make sure that their studies were were a little bit longer than average. But, you know, just because the vaccines came around, quote unquote, quickly, you know, in a year or so, doesn't mean we can't trust them. So we've touched on new variants already. And the question becomes, will the current vaccines protect me from the new variants? The answer to that is mostly. So we could see that the Pfizer vaccine has strong protection against the UK variant, but they haven't really looked at it against the other ones. The Moderna vaccine has good effectiveness against the UK and South African variant, but weaker protection against the Brazilian variant. So these variants they're spike proteins that those little coronas, those when we look at a picture of a coronavirus, those spikes on the outside of the virus, they can change as well. So if they change enough, then your antibody doesn't recognize them quite as well as if it, you know, was unmutated coronavirus. Does that mean that it doesn't recognize it at all? No, it doesn't. What it means is it'll help, but it won't be as effective as it was against the original variety of vaccine or of virus, excuse me.
Yeah, they haven't released any of the percentages. You know, Mike had mentioned earlier that you know, the Pfizer is 95% effective against the original COVID-19, and the Moderna is 94 point something percent effective. So just remember, we're looking for greater than 70, greater than 75%. So even if it's slightly less effective against some of these variants, it's still more than enough to keep us safe. So if it drops down to 80 or 85% effective, that's still more than enough to help us get rid of COVID in its entirety. So I think that's important.
I think if we I think if we go back on the slide that had all the different vaccines up there, like the Johnson & Johnson one has been studied against some of these variants, and it's shown to be in the 60, 65, 66% effective against a couple of them. I think it was more effective in the United States in the lower 70% and in the mid 60% in some other areas, but it still doesn't mean that vaccine is ineffective. If that's the only one that you can get, or that's the one that's convenient for you, or you know, you don't want to deal with a second shot, it's okay. You know, that can still be the right choice. You know, and I try to relate things to what we already have, and our flu vaccine annually that we all know is important, and we know that it helps with you can still get the flu after you get your flu vaccine, but you never seem to get as sick, because even if it wasn't the exact flu virus that infected you, it was very similar to the flu virus that infected you, which helps your body fight the flu virus that ended up still infecting you that wasn't the same as the vaccine. So I think as time goes on, we'll find similar effectiveness and similar variations with COVID-19, and whether it involves a booster annually or not, I mean, we're only 1 year in, so we don't know that just yet. So we'll see, time will tell. So just some take-home points. Be sure to get both shots. We know that it's not 21 and 28 days anymore. You can wait up to 42 days. There's ongoing studies that are looking at extending that, and we know there's studies that we already discussed looking at whether you need to make sure you get the same brand. So more to come on that. The vaccine prevents you from getting symptoms of the disease, but not necessarily spreading it. Again, the example I use, which is, you know, a real life factual example, is a facility that where they all got their first dose, and then they had a quote unquote outbreak where a bunch of residents ended up COVID positive, but no one was symptomatic. No one even got a fever. So they were protected from the disease itself, but all those people had to, you know, be watched to make sure they weren't spreading it to someone who wasn't vaccinated. We got to remember to continue to wear a mask and follow our PPE guidelines. make sure we're social distancing, and just try and do whatever we can physically to prevent the spread. They expect that you're fully vaccinated or fully protected 7 days after your second shot. There's some data out there that maybe that's 14 days and maybe it's 21 days. Right now they're saying 7 days. If you have antibodies or previously had COVID-19, you should still get the vaccine. You should still quarantine if you've been exposed to someone who's tested positive, even if you took the vaccine. So again, it's a dynamic process. We've all learned a lot. We've all, it's still evolving. So will some of these take home points change over time? I would imagine they would. I mean, we already know that some of these timelines are going to change. So hopefully we'll have some better news as time goes on. But for now, these take home points are pretty secure in making sure that we all stay safe.
So I think it's important for us to just kind of remind you, our goal for this presentation is to just give you the facts that you need to make your own decision. Obviously, from Michael and myself, we both encourage you to get vaccinated. But if it's not the right thing for you, it is your decision, right? Where our goal is to make it so that you can make an educated decision. If you have any if you have any personal health history that we don't know about, ask your doctor. But like I said before, expect that the doctor may say, hey, you should still get the vaccine. But again, our goal is to make sure that we provide you with some good, accurate information here today, so that you can go and make an educated decision about whether you're going to get vaccinated or not. And certainly, like I said, we encourage you to do so, but that is certainly your choice. So with that, we'll open it up to any questions. I see one that just popped in here. If you take Tylenol after the first shot without experiencing side effect, does it lessen the strength of the vaccine? The answer is no. Tylenol doesn't have any impact on the vaccine whatsoever. So if you have sore arm, or you're feeling feverish or anything like that after you get the vaccine, it's safe to take Tylenol. It's not going to impact the vaccine at all. The recommendation is, I will say this, the recommendation is you need to wait until you experience those side effects before you take Tylenol or Advil or anything else for that matter. So do not take it before you get the shot, but it doesn't impact it when you take it after you've already had the shot in any way. So I keep hearing rumors that the COVID virus is in the vaccine and in the current flu shots. Is this true? So as we talked about, in the COVID vaccine itself is a small snippet of messenger RNA that allows you to build immunity. You cannot get COVID from the vaccine, and it is not COVID that is in the vaccine. And they are not combining the COVID vaccines with anything else. The flu shots are just flu shots, and they are the same flu shots that we've been given since September of last year. And does that mean that in the future they won't put COVID and flu shots combined together? No, but currently they are two separate vaccinations, and there is not a combination product of any of those. You'll see on the news that the flu season particularly has been much less this year. And that is entirely because of all of the social distancing and mask wearing and everything else that we've been doing. We could, if we wanted to continue wearing masks and not going near anyone and not eating at restaurants and all that other kind of stuff, we could make all this stuff a thing of the past. But obviously we want to go back to some sort of normalcy. And I'd like to be able to talk to my neighbors from somewhere other than just yelling across the street from 20 feet away. So again, it's something that we just got to keep doing until it's safe to return to some sort of normalcy. So with that, I don't see any other questions. We'll give folks another couple of minutes here. Michael, as always, thank you for helping me out with this. I do appreciate it as always.
No trouble. It's my pleasure.
And listen, we know that everybody's busy, so we truly appreciate you all taking some time to listen to us. Hopefully we answered any questions that you may have about the vaccines. Hopefully we may have even answered some questions about the virus itself. But again, our goal was pretty simple, and that's to make sure that you guys all have the facts so that you can make an educated decision about whether you want to get the vaccine or not. And like I mentioned before, I'll mention it one more time. We certainly encourage you to do so. So get vaccinated. If you have questions, talk to your doctor before you sign up and make an appointment. You know, we're seeing a lot more appointments. I was at Publix the other day, and they were giving that particular Publix was giving their very first COVID vaccination. So. So one other question that came in here, and again, thank you all for some very kind comments here. We do appreciate that. Are you going to make the presentation available to attendees? The answer is yes. We absolutely can do that. We're more than happy to share this with others. Whoever you got the invite from, reach out to them, and they can either get the presentation from myself, or they may actually already have it and we'll get it sent over to you. So whoever sent you the invite, reach back out to them, and they have access to the presentation, but we are happy to share it.